Mm. Hi, I'm Elizabeth. I work as the long-term conditions lead for Swindon Talking Therapies. I originally trained as a clinical psychologist, and my particular interest is in the crossover between our physical and mental well-being. So, what is a long term health condition? So, this is any condition that has to be managed in the long term rather than cured and treated in the short term. 4 in 10 of us live with at least one long term health condition. And some of the more common conditions that we might see include things like diabetes, heart disease, lung conditions, long COVID, chronic pain, fatigue. We also see people who have persistent physical symptoms where perhaps a medical diagnosis hasn't been found for them. We also know that 2/3 of people living with a long term health condition experience an impact on their mental well-being. Living with a long term condition can be hard, both practically and emotionally, as they can have such wide reaching impact on our lives. We might have to make changes like new medications, new lifestyle habits. We might not be able to do the things that we used to do, like our hobbies or the things that matter to us, or we might have to do those things differently. We might have to manage some new or scary symptoms, or we might have worries about what will happen in the future. All of this can be really overwhelming, and it's just quite common for people to feel low, anxious, frustrated, and stressed at times. Our long-term conditions pathway helps people where their long-term condition is impacting how they feel, or where our mental health is making it harder to manage the long-term condition. This is often based on cognitive behavioral therapy, where we learn to understand the role of thoughts, feelings, and behaviors in keeping us trapped in vicious cycles. For example, it's really common for people to push themselves quite hard on their good days, but then to have a crash later on where our symptoms might flare up. And then we can get trapped in this cycle of boom and bust, where sometimes we overdo it, and then perhaps over time we find we can do even less. We might understandably feel anxious about our symptoms, particularly things like breathlessness or strange pains in our body. Often, anxiety can mimic or even worsen some of these symptoms, and we can start to avoid doing things so we don't feel so anxious. Again, that can often help us feel better in the short term, but in the long run, it means our symptoms can get worse and we miss out on the things in life that matter to us. So, CBT is all about understanding and changing these cycles so that we can live a life that makes us feel happier and more fulfilled. We have some specialist options for people living with long term conditions, including adapted online programs, group courses, and access to specialist clinicians with extra training in long term health conditions. I see some clients myself, but also my role is to support our staff, to support clients with long term conditions in a better way. So I might do things like training for staff. I do lots of supervision where we talk about the people that our staff are working with, and I create resources so staff feel supported to help their clients. Historically, the NHS has been very separated into physical and mental health services. So part of my role is to help us work better together across the NHS. So we work alongside some of our physical healthcare colleagues. We might co-facilitate courses together, or we try and make sure that it's easy for people to be referred in between our services. All in all, kind of the overall aim is to try and give people living with long-term health conditions a good experience of holistic healthcare for their physical and their mental health. So it's all joined up and helps them to feel better in the long term.